Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're going to be sharing the best kept secret in terms of rehabbing your patellofemoral pain syndromes. Hope you enjoy. So, in 30 years of chiropractic rehabilitation of sports injuries, with a ton of patellofemoral pain syndrome success, I'm going to share with you today one of the best kept secrets in rehab that a lot of people are not utilizing. Remember, patellofemoral pain syndrome is where that kneecap is having pressure, usually being pulled outside and up out of its normal position. And depending on your unique bony abnormalities, you may have an increased Q angle, which is the angle between your upper leg and lower leg. You may have a shallow femoral condyle or intercondylar groove where the kneecap sits in that, and it's shallow and it allows the cartilage to become rubbed and aggravated. You may have a patella alta where the patella is drawn upwards. You may have pronation problems where the inside of your heel falls down. You may have hip realignment problems which stress the IT band, and then that pulls along with your vastus lateralis. Any of these problems can be helped with this following exercise, which is why this exercise is so common to, regardless of the cause that I see, many of my patients suffer with patellofemoral pain syndrome. I always include this one secret exercise to help them along, to help stabilize that patella and decrease their patellofemoral pains. So here it is. We start with the kneecap in the seated position. And what we're going to do is we're going to straighten the knee so it just has a slight bend and the foot is flat on the floor. Okay? Don't have it locked out. Make sure there's a little bend to the knee. With your two fingers, you can use your index fingers, you're going to feel the inner and outer aspects of your kneecap. And as you tighten or try to straighten that knee, normally as you do that, what you'll feel is the kneecap will head towards the outside. In other words, you'll feel more pressure with the kneecap pushing into the outer finger and away from your indefinger. This indicates a lateral tracking patella, which is the kneecap is tracking out of its normal groove, being pulled sideways due to a muscular imbalance between the VMO, or vastus medialis obliquus, on the inside part of your kneecap, and the outer structures, the lateral iliotibial band, the vastus lateralis, where those are too tight, too strong, and there's a weakness in the VMO. And again, that can be complicated by these bony abnormalities we mentioned. But the exercise is simply to exert an isometric tension with your kneecap moving inwards towards your midline. Now by isometric, I mean I'm going to tense. You can start with the whole thigh inwards, as if you're trying to resist pressure pushing your leg out, and that's going to start to wake up that VMO muscle to help coordinate the motion of that kneecap more towards the inside, bringing it back into its groove. So again, if you put your fingers on the inner and outer aspect of the kneecap and give yourself a little tension with the thigh and the knee inwards, and when you first start this, you can use the whole leg to tense inwards, but as you get better at it, you want to localize the force just to the kneecap tensing in. As you do that and continue that pressure as you straighten your knee, you'll notice that you now have better control. The kneecap will be exerting more of a pressure towards the inner finger. Okay? To assist that, and here's the big secret, because a lot of people will teach kneecap tracking using an adduction or a medial isometric tension. But what assists that is a nice reflex that exists with the foot in relation to the knee. So if you push the big ball of that foot, that's the large mound right behind your great toe, down into the floor without moving the leg or the ankle, you just want to tense that big ball down into the floor. As you do that, you'll notice that will assist that tension, and as you maintain that big ball down, you'll notice that the kneecap starts to tense more inwards as you straighten your knee. So again, I'm maintaining tension with the kneecap in, as well as tension with the big ball, not rocking the whole heel inwards, just the front of the foot, the big ball on the forefoot, rocking that down or pressing that down into the ground. And I maintain the knee in and the big ball down pressure as I straighten that knee, and you'll notice that'll start to wake up that VMO muscle, and you'll notice that the kneecap will start to pull more towards the inside. You practice that for repetitions, going back and forth as you straighten your knee, building up the reps, every other day, or you can do a couple reps every day to practice just the coordination. But strengthening, remember, we want to leave a day's rest in between workouts and build up to eventually a set of 40 or 50 reps. When you get good at that, we can then transpose that into a standing position where we take a parallel stance with our feet and use the same thing, tensing the kneecap inwards and applying the big ball down pressure into the floor. Now, one of the things we don't want to do is have the whole heel fall in, because that's pronation, and that many times is associated with lateral tracking patella. So what we want to do is keep the outer heel down while the inner forefoot goes down. So the foot's almost twisting. And if you do that, you'll be able to tell, coming up out of a squatted position, that there'll be more tension on the inside of the kneecap than the outer, or the same amount of tension, and that'll help to guide your kneecap back into position, alleviating a lot of the pressure from chondromalacia patella, from patellofemoral pain syndromes, from lateral tracking kneecaps. So if you like this exercise, we have more exercises concerning patella problems, including hip realignment exercises, healing exercises for foot function, because remember, kneecap trouble almost always starts in either the hip or the foot, or a combination of both. And although this exercise is a great one to help localize the VMO muscle and to train that kneecap to track correctly, you'll need those other exercises to complement your rehab to really help you get over your pains. So if you like that, we have more on the Pain Free and Fit and Posture Size websites. You can also give me a thumbs up if you like this video so we can share it with others suffering from this problem, and leave me a question or comment. I'd be happy to try to answer your questions. Hope you enjoy the exercise and hope it helps with your patellofemoral pain syndromes.